Please welcome Lyft Vice President of Healthcare Megan Callahan, Dr. Trent Haywood, and James Ricciuiti.
Well, my name is Jim Ricciuiti, and I'm here to moderate our next panel entitled A Game Changer in Health, Creating Access to Transportation to Improve Health Outcomes. And what we will be talking about this morning, obviously, is to continue the dialogue and dive a little deeper around implementing some of the new flexible benefits that are available under the Chronic Care Act and as the regulations promulgated by CMS to really deliver more value through MA. And this is around these flexible benefits for those with chronic care. So let me introduce here our two panelists, and then we'll get out of the way and have a short video. But first, we have Megan Callahan here, who is Vice President of Healthcare for Lyft. Everybody knows what Lyft is, and we're going to talk a little bit more about what they're doing in healthcare in cooperation and collaboration with BCBS and others. Megan runs all the healthcare businesses at Lyft, and previously she was the Chief Strategy Officer for Change Healthcare. And my right here is Dr. Trent Haywood. He's a physician and the Chief Medical Officer and Senior VP of the Blue Cross Blue Shield Association. That's the federation of 36 individual Blue Cross Blue Shield healthcare companies across the country. And he's also president of the Blue Cross Blue Shield Institute. And prior to that, he held a position as Deputy Chief Medical Officer of CMS. So two terrific panelists, and we're going to have a wonderful discussion. As we tee it up here, we're going to start with a real brief video, if that all works, and we'll facilitate a nice conversation and hope to take some of your questions at the end. Okay, could we show the video, please?
One of the things that people don't realize is that you could have the best doctors in the world, best nurses in the world, you could have the best facilities in the world, but if patients can't actually get to them when they need them, they're of no value to the patient.
Our members trust us to take care of their health care. Transportation is part of that. When transportation is not reliable, that's a trust factor, and that's a really big deal to Caremore. A few years ago, we received a letter from a member who had been waiting for 45 minutes on a curb in the desert. That was clearly a turning point where we said, enough is enough. It's time to find a better solution.
One of the challenges that we've faced, and one of the reasons that people frequently tell us that they don't access care, is that they don't like traditional models of transportation. Those traditional models of transportation make you wait. Oftentimes, the service levels are very poor. The drivers aren't particularly courteous. And time again, I've heard of patients who forego receiving medical care because the actual transport to and from those appointments is not convenient, it's not patient-centered. And so we were very excited to partner with Lyft to try to do something totally different in the industry.
The product that we implemented with Lyft was non-emergency medical transportation. Essentially, doing common sense intervention with patients to get them to the doctor appointments that they needed to get to.
Giving our patients access to a curb-to-curb service like Lyft makes sure that patients are going to get to their appointments, get there on time, and then actually be picked up on time to be brought home.
We have a tool that communicates behind the scenes to schedule the ride. Very simple. Then we have built a second desktop tool called My Ride Manager, and that tool tells them when the car is arriving and when the member might want to get up and walk outside. It's a technology that's not smartphone-based, but is rather patient-based.
I think Lyft has brought the best of digitization to really modernizing logistics, and I think that there's opportunities for both organizations to learn from each other. Lyft, Caremore, getting together, we were the first in the industry to show that non-emergency medical transportation could be used to improve the care delivery experience for seniors.
Okay, great. So what I really like about that video is it shows the provider perspective as well as the plan perspective and the collaboration that's essential to make some of these great innovations come to life. So let's begin. Megan, everybody knows Lyft, as mentioned. Could you tell us a little bit about the healthcare businesses at Lyft, what you're up to, and how you work with MA plans and provider organizations?
Sure, happy to. Everybody, thanks for having us here today. I'm going to spend a little bit of time just grounding you on what Lyft is doing in healthcare. I'm going to try and not make it too much of a commercial, but I think it's really helpful to have a shared understanding of how we are active in the healthcare space. So the first thing I'll say is that we are a leader in transportation in the healthcare space. We've been at this for almost 3.5 years. We work with 9 out of the top 10 health systems. We work with the top transportation brokers in exclusive arrangements around the country. And obviously we work with top payers like CareMore, which is a subsidiary of Anthem, with the Blue Cross Blue Shield Association, with Cigna, with Humana. So we are operating from a scaled position as we evolve transportation and healthcare. One thing around where we started with CareMore was obviously around getting patients to medical care. And we've got some great statistics that I want to share with you just around how that actually helped their particular program. They saw a 39% reduction in cost. They saw their patient satisfaction is at 98%. They saw wait times decrease by 45%. And now 90% of their curb-to-curb rides are delivered through Lyft. They were able to take all those savings and roll that back just to offer more transportation benefits to their members. I talked a little bit about them starting in getting patients to medical care, but if you follow Dr. Jean on Twitter or any social media, you'll see that he talks a lot about radical common sense and applying radical common sense to his membership. And he also talks a lot about the epidemic of loneliness in this country and how in seniors it's highly correlated to chronic disease. So one thing that we've been able to show at Lyft, and I'll talk a little bit, is about how we, through our transportation programs, are helping to reduce social isolation in seniors. And with the flexibility that you've all been providing, the supplemental benefits, being able to take that flexibility and apply it to get seniors to silver sneakers, or to get them to places of worship, or to visit their grandchildren, or whatever it is that makes them feel, connected to their communities. And as we transition as an industry and go from thinking about medical care to true health, and we kind of grapple with as an industry on how to pay for that, how to pay for things that don't happen, that's really kind of the epicenter of where Lyft wants to be as part of the conversation. I'm just going to talk one more minute about how it works, because it's not your consumer app. So we're a business-to-business platform. So what they talked about in the video is not just unique to CareMore. It is how Trent uses our application. A senior does not need to have a smartphone. They have the sponsoring organization, whoever's paying for the ride, whether that's a health plan, a health system, they actually call the ride for the member. Think a care manager or someone working in a call center. They call that ride on behalf of the patient. The patient, if they do have a phone, even just a flip phone, they can get text messages that tell them where to be and how to communicate with their rider. Or we can make robocalls to landlines for seniors who don't even have a smartphone at all. So we've tried to really take the complexity out of it, particularly for the senior population. And one thing, as someone with an 83-year-old mother, what's really been interesting, and one message I really want to get across to this group, is seniors will use rideshare. They use it, and we've got some great statistics on that. Particularly with CareMore and other seniors, we do a lot of onboarding and education in terms of what the car is going to look like and how to access it. So they do get comfortable with it. But after that happens, they're great adopters of rideshare, and I'm going to talk a little bit more about that in a little bit. And lastly, I just want to talk about why that's important, right? So earlier in my career, I spent a lot of time in case and disease management, and as we were doing problems, goals, and interventions, the number one problem was always transportation, and the number two problem was always language. So as you're thinking about managing chronic conditions and complex care plans, the best way to get them to adhere to those care plans is to actually enable them to get to the care, and to the services that they need. So we really view, we're biased, but we view transportation as really not only a critical SDOH, but really a conduit to satisfy all the other social determinants of health. If it's food insecurity, if it's inability to get to community events, it is kind of a cornerstone to us, we believe, around social determinants in general. And lastly, I'll just say around consumerism, we saw Bruce talk about consumerism. We've talked about it a lot. Lyft is obviously, based on its consumer roots, very adept and very good at consumer experiences. One thing, as I go around and I talk to payers, it's really interesting to me to see that transportation is actually one of their #1 grievances. It's what lights up your call centers. It's what your call center agents spend time, and it impacts your brand. And it is a relatively easy thing to fix with the right investments. And in particular, we want to create an experience for members where they don't feel less than. I don't want them to feel like their access to their medical care is any different than them going to the grocery store or going out to dinner or going anywhere else. So how do we level that playing field so they have a really good and rich consumer experience? And in particular for MA, as you transition to value-based care and there's more measures associated with member satisfaction, how can transportation factor into that conversation? Sorry, that was a little long-winded.
Super, that's
but I wanted
okay.
to
That's
tee it all up.
really making all of the theory and the policy tangible, I think, to those of us on the front lines in the provider and plan and community organization community for the opportunities going forward. So Trent, could you share a little bit about your strategy at BCBSA in this field, and why did you decide to partner with Lyft?
Yeah. Well, thanks, Jim. And I know you said everybody knows Lyft, so I'm assuming people know Blue Cross and Blue Shield. so just
got my card right here.
Right,
Trent.
just to put it out there. So picking off where Megan said, so 2 summers ago, in May of now 2017, there was 2 things I had to get done. One was I had to get down to my daughter's college graduation and not embarrass her among her peers that she built this relationship and now dad is coming for graduation, so I had to do that. And right before that, I had to make the big national announcement at our Blue Cross Blue Shield Summit that we had a strategic relationship with Lyft, which went pretty viral. I don't know if you guys saw it, even when it was on Jimmy Fallon's monologue that night. I mean, it really went everywhere.
I think you'd be good on that.
Well, I might. We might try that. But part of the reason why that was so important for us is that it really was a strategic decision that we thought what's happening in healthcare is not only are we going to do important things that you just heard Seema talk about in terms of modifications and modernization of physician or provider payment, which I worked on when I was at CMS, but we thought what was going to be critically important if we're really going to make a difference for the health of America, and particularly when we talk about population health, we had to move outside the 4 walls of the clinical setting back into the community. We thought most healthcare decisions actually occur in the community setting. And so we need to be part of the community setting in a much richer way, which is what Jim was talking about, moving from theory to the actual practice. So we set about identifying a particular partner that understood that this wasn't just going to be transactional in nature, that we actually thought that this was going to be a fundamental change in how healthcare was being perceived and how it would actually be delivered in those community settings. And so obviously we want to be able to look for a partner such as Lyft that early on said this is not just about a transaction, it's about establishing a relationship. The relationship for particularly Blue Cross and Blue Shield members are pretty important. When Megan talked about consumer satisfaction and consumer engagement, Blue Cross and Blue Shield has a brand that's well recognized for being able to be part of the community and always recognizing what's important in that particular community. So we're excited. We were excited to be able to make that announcement 2 years ago, and we're excited to continue to grow that relationship. And now, as you can see, with CMS now coming along and allowing supplemental medical benefits, we feel like we made the right strategic decision back then, and we're going to see the fruition of this unfold as we think pretty much 2 years from now, if we come back, it'll be table stakes. We believe that everybody will have some type of transportation benefit, and we'll talk about some other benefits at the end of this if we have time as well.
Very good, thank you. Megan, let's come back to you here and pivot a little bit to talk about, you mentioned it a bit earlier, but one part of the transportation equation obviously is getting folks to their physician appointments sort of in the healthcare, the normal healthcare infrastructure. But Can you tell us a little bit more about how you're thinking about those other aspects beyond the doctor's office that are important to hit the isolation and other
definitely.
aspects?
And Trent, maybe you can follow on. I'll start, and then you can talk about what you're doing within Blue Cross Blue Shield Association. At Lyft, we've got some great data, not only on the outcomes like the CareMore outcomes that I showed you, but talked about, but how access to rideshare, which we believe is the most efficient and cost-effective form of transportation, leads to higher quality of life, which is a leading indicator of health status. So we have preliminary results of a study that we did with USC and AARP and United Health Group, actually, where we offered free lifts for 3 months to seniors in the LA region. I think they had to be within 50 miles of USC. And they used that unlimited for 3 months. They obviously used it to get to their physician appointments, but a lot of their rides were to see family and to go to community events and go to fitness centers. And the first thing I'll say, and back to my point of seniors use rideshare, they actually used the consumer app, so they didn't use our business-to-business platform. 75% of those seniors opted in initially to use the app, and the other 25% that started using a call center option transitioned to the app. So they really liked, the control, I think, that they had, and they can navigate the technology. But the other thing that we saw is they had a 35% increase in their physical activity, and they had a 90% rating for quality of life at the end of that study, which we thought was huge. And of course, there was many other things that we would have liked to have measured in that study, but we thought that was a really great starting point, and we'll be interested in continuing to do that kind of research to demonstrate the power of transportation to access social determinants in the senior population.
Yeah, just real quick, building off Megan's comments, the way that we looked at it from the beginning was, how does this ultimately impact healthcare utilization, healthcare outcomes? Because we want to be able to see, if you live in a certain community, do these social determinants of health, such as transportation, impact what you actually see comes through in terms of either identification of diagnoses or conditions, or those healthcare utilization patterns that can be avoidable, such as avoidable hospitalization, avoidable ER visits. And we saw that in our data, so we have pretty rich data, Community Health Management Hub, that allows us to be able to look at our own proprietary data as well as capture other proprietary data. Once we do that, we put in a solution such as transportation to be able to see the impact. And what we found is that it's not just looking at it from the standpoint of a PCP desert if you have inadequate access to PCPs, or a pharmacy desert where the pharmacy desert means inadequate access to the pharmacy, which leads to worse medication adherence rates, which is why you would also allow those rides to go to the pharmacy. But to Megan's point, you also look at it from a fitness standpoint as well, or the other opportunities to be able to allow them to go to places where they need better access to fitness. And so the transportation for us was the first benefit that we thought was foundational. That opens up all these other opportunities to improve the health outcomes for those particular populations.
Awesome, thank you. So I think it's my turn to take a question.
Yeah, I think it would probably be helpful, given your policy background, if you could maybe just make sure everybody understands around the supplemental benefits
Sure.
and what flexibilities were actually offered.
Awesome, thank you. So I think many people in the room probably have a pretty good grasp of that, having looked through 187 pages of CMS regulations and so on with the call letter. But overall, this is a remarkable change that has taken place in what's the opportunity that's available. Because those two criteria that are now fundamentally different from everything in the past together, the two criteria being that the benefits themselves do not have to be directly, substantially health related, number one, and number two, the ability to tailor benefits to subpopulations and different packages of different benefits to those subpopulations. So together, that's an incredibly powerful combination and an engine for innovation, quite frankly, in MA, which, hey, it was a little provision, a little bipartisan law last year, in 2018, believe it or not, bipartisan, okay? So this is what's out there for the ecosystem, whatever you want to call it, that's in this room, frankly, the leadership thereof, to go make things happen. And when you think about what the expectation would be from policymakers, from my perspective, in the Congress, in CMS is, okay, we gave you what you asked for, healthcare system. now go use this new authority. Go develop, go innovate. The worst thing that could happen was not much does happen. And I think directionally, Trent is spot on by saying within a couple of years, I could see this becoming table stakes. But to do that, people have to go out and innovate and grab the opportunity because, without any risk, there's no gain. So that's a little perspective on the policy. And that it does come back around to the timing here. This is a 2 to 3 year cadence. If you step back and think about the annual timeline that we all deal with in Medicare Advantage. Next year, we know in the fall what will be available for next year. But hey, June of next year is when the deadline is for submission of bids for yet the following year. And so early feedback and data and analytics on what's going on out there, to me, has the opportunity to create a virtuous loop of information, best practices, learnings that could continue this going forward.
Just teeing off of that, the timing of this, right, was I think a little challenging. But as I think, if I'm in your shoes as MA plans, there's a great McKinsey study that came out that said that if you had a barrier to care that was transportation, that you were 2.6 times more likely to have multiple ED visits, and you were 2.2 times more likely to end up as an inpatient within a 12-month period. So if you look at that and you think about, well, how can I competitively price my plan, right? If I'm trying to offer additional benefits under these flexibilities. I think the conversation gets to be about, transportation as a relatively cheap investment. And if you can put $1 in transportation, what does that get you down the line in terms of, cost avoidance or things that don't happen, like ED or inpatient admissions? And in particular, the ability to customize to different chronically ill populations and to start to do some pilots and start to do some experiments around, what populations would actually benefit from a transportation benefit. And maybe where do you not need to put that as a focus? And Trent, I know you're going around talking to a lot of chief medical officers around Blue Cross Blue Shield plans. Could you maybe share a little bit with what you're hearing,
sure.
how people are thinking about it?
And it's not just on the clinical side, it's also on the product side as well, because on that side, of course, they have to be able to feel pretty comfortable that you can put in a competitive product, if you will, a MA product, and still be able to manage the premiums, as Seema talked a little bit about how the trend is related to make certain that the premiums don't necessarily increase in a competitive market. So we spend a lot of time looking at our particular data and get pretty granular about how you actually put that into the marketplace, which is, as you just talked about, which means in that 2-month period, for people that weren't already thinking there was a really compressed cycle. But it allowed those plans that even weren't going to necessarily do it for 2020 to start moving forward, as Jim said, for 2021. When we do that, that gets into very specifics about distances and how far those individuals are traveling, what you see that network looks like, to be able to see the opportunity that those individuals would be going to those particular providers for you that are providers in this system. And then ultimately being able to do some benchmark comparisons. And so through relationship with Lyft and others, we're normally able to be able to see pricing within market that we can get that's better than even a taxi cab. So I know a lot of health system tradition would give taxi cab vouchers and others. Through this type of relationship, you're actually able to be more competitive than even the local taxi cab company. So that's one thing to keep in mind. On the provider side, we also thought we were doing some work with providers, and just similar to what you saw in the video, they're pretty ecstatic about it. Some, if they go back and look at what's happening in terms of no-show rates for those PCPs, it actually improves that, so it decreases your no-show rate. I know that's a big problem for efficiencies in physicians' offices. So from that perspective as well, it's been well received. And I do think by 2021, if you haven't done it, if you're not doing it for 2020, you definitely have time now to be able to take advantage of it and get pretty granular about how you want to structure that. And if we need to, whether it be with Megan or with our team at Blue Cross and Blue Shield, we can help you through that process if needed as well.
Awesome. Thank you. Well, I think we've got a few minutes left, and we would potentially, would you like to have another word here before we go to Q&A, or shall we take a few questions from the audience? What do you think?
We can take a couple questions, sure.
Okay. Because I think anybody want to feel courageous and step up to the microphone and ask a question? You got some great resources here on the stage about really making supplemental benefits generally, and particularly transportation, how it relates to other benefits. Riveted. Hi, would you mind just stepping, there's a mic, oh, here comes a mic, or there's one right back there. Would you mind stepping over there? Would that be okay? Here it comes. Excellent. Thanks, Kristen. Yeah.
Hi, thank you. I serve a population of people who are typically dual eligible and primarily people who utilize wheelchairs. So thinking about their specific needs, they have very complex medical conditions, so they need lots of care, but they can't get there. The public wheelchair I'm in Philadelphia, so the public wheelchair transportation is difficult.
Challenging.
And so I'm just wondering, have you looked at pilots that really are supporting people with that level of transportation need and that kind of transportation need?
Yeah, I'll answer that question two ways. First, I talked in the beginning about our exclusive relationships with broker partners, and think of a broker as an Expedia for non-emergent medical transportation. And the reason that that's important is because they really assess the needs of the member and if they're appropriate for a Lyft, because we're not appropriate for every rider, right? And certainly for every senior. And then they triage us to the rides that they feel that we're appropriate for. And then they, of course, have all kinds of, they have wheelchair and stretchers and every other kind of fleet available. But secondarily to that, Lyft does have wave vehicles, as we call them, in certain areas, and we are starting to experiment with that as well. So probably more to come on that, but most plans are working through a broker, and you can certainly still access Lyft and serve your wheelchair accessible.
Right, and just to piggyback on Megan, so one of the reasons why we need that flexibility that Megan was talking about in the B2B format is so that we can allow on our side, so they don't download the Lyft app because we can push through the API integration. And what we did was also integrate with those wheelchair assist vehicle entities as well. So that's also another opportunity, the reason why it's so critically important. So again, more than happy to share that information offline, just email us and we can connect.
Yeah.
Super. Thank you. I think I'm sorry, I can't really see you because of the lights, but I believe there's a question over there.
Yes, in some ways, building on the previous question, I would love to hear your experience of, in terms of providing transportation, non-emergency medical transportation in rural areas, both the extent to which you have a presence in rural areas already, and if there are challenges that you've already identified or anticipate and have plans on how you can address those.
Yeah, well, certainly we understand that access in rural communities is a challenge across the country. Lyft right now, our network covers 96% of the United States. So, we cover most areas, and certainly we're opening new markets all the time. So if we do form a relationship, let's say with a health system or a health plan that has members in a rural area, oftentimes we get into a conversation around, well, can our emerging markets team go out there and stand up a presence in that community and not only provide access to healthcare for patients, but actually provide income opportunities for drivers in that community. So we really try and approach that as a win-win. But of course, it varies by community. And Trent, I don't know if you've got.
No, I'm just going to build off. One of the nice things that Megan and the team did was to allow for that access issue to be overcome in those rural areas. Unlike what most of you might be familiar with if you're in a concentrated area like DC, is to be able to schedule it. So to Megan's point about being able to be income for the individual drivers, but it does overcome that access issue. So it's not necessarily on demand like you would think if you run downstairs and just do on demand. But it did allow us to be able to start to address the more rural population by being able to schedule those particular rides. And so that's how you've been able to get the density in the network that you need as well.
All right, we have one more question here, I think we have time for.
Is it on? Thank you.
Yep.
So it's one thing, this is more of a supplemental benefits question. It's one thing to contract out transportation services that seems like to be minimal risk. I'm concerned more of the trend where some of the plans are looking at online registries particularly for home care services, for example. And the fact that there's some contracting going on with some of these entities that really take no responsibility for the care. It's just matching people up online. And I'm just wondering, this is more probably for Trent, as far as an MA plan, to see what accountability is Blue Cross Blue Shield taking. And I know, for example, overseeing transportation services is one thing where you're taking some accountability if something does happen in that Lyft ride, for example. What is the plan taking responsibility for that? And also, as you translate that into other services, what kind of accountability and responsibility is Blue Cross and others taking when it comes to providing other services?
Yeah, well, I think at a high level, then I get into specifics. You know, we've always continued, we'll always kind of consider sacrosanct the relationship with the members and the Blue Cross and Blue Shield member and being able to protect that member and also meet the expectations of the member. That doesn't matter to us whether it's a traditional healthcare service at the physician office or whether in these more supplemental medical benefits such as transportation. I do think you're going to see more movement into the community setting or the home setting in specific. So in addition to transportation, we're moving forward in nutrition. And so you see a lot of activity that we're doing related to nutrition, as well as one of those supplemental medical benefits that some of the plans are doing right now. And then because of what's occurring from a technology innovation standpoint, it allows more activity into the home setting. So you have more devices that you can take advantage of in that home setting. Everything from traditional aspects that you do with heart failure patients, such as being able to get the readouts for the scales, all the way to now more personal assistant type technology that allow you to be able to get personal assistance. So I do think you're going to see more of that, but I think it's going to be because of the technology innovation that you have, it can be monitored in a more secure setting than what you would have done a decade ago in the home.
Got it. Good. Thank you. Well, I'll just give Megan the last word here.
Yeah, well, I would just say, you know, as you're all kind of navigating your way through this over the next couple of years, I would look to Lyft as a partner, just like we've partnered with CareMore and with Blue Cross Blue Shield Association. You know, we go around and work with payers to really talk about, you know, what are your clinical programs and how can we bundle in transportation and create really targeted interventions to certain populations. And I think, you know, what we're really excited with is creating more of those types of pilots and partnerships and really starting to study and do research and look at outcomes and how that benefits the senior population in the MA program overall. So don't hesitate to reach out, and hopefully, you know, this has been a productive discussion.
Good. Thank you very much.